Hello everyone, this is Medical Gateway, and in this part we are going to study regarding the lines of defense during inflammation. So lines of defense. So there are 4 lines of defense. The first line of defense, second line of defense, third line of defense, and fourth line of defense. So line of defense means that if there is some infection in the tissues, there is some foreign invader in the tissues, so which of the WBCs is going to come first and going to fight with the foreign invaders in the tissues? So the first WBC, which is the first line of defense, and after that the second type of WBCs will come, which is the second line of defense, and so forth and so on. So first line of defense, whenever there is infection in the tissues, the first WBCs to come and fight with the foreign invaders is the tissue macrophages. So it's pretty simple that which WBCs are present in the tissues. So which one are present? Only the tissue macrophages are present in the tissues and which are readily available to fight. Neutrophils are not naturally present in the tissues. They're present in the blood. Monocytes are not in the tissues. They're first present in the blood, then they move to the tissues. Okay, so the first line of defense is by the tissue macrophages. So now, when the tissue macrophages have fought, but they are unable to kill the foreign invader, and the war goes on, then what is the second line of defense? The second line of defense are the neutrophils, which will move from the blood into the tissues as described in the previous parts, and these neutrophils will go and fight the foreign invaders. So these are the second line of defense. First line of defense is the tissue macrophages already present in the tissues, and second line of defense is basically the neutrophils, which are moving from the blood and moving into the tissues. Now we have third line of defense. So now what is the third line of defense? So the third line of defense is the monocytes. So monocytes are going to move from the blood and they will enter into the tissues, and as you know, these monocytes are going to be converted into the tissue macrophages, and then they will fight. They will not fight as monocytes. So monocytes are present in the blood. They will move from the blood into the tissues, and they will be converted into the tissue macrophages, and then they will fight. So now tissue macrophages are involved in the fight, then the neutrophils come for defense, then the monocytes come for defense. Now what is left behind? Now, fourth line of defense. When the war goes on for a very long period of time, what happens? The granulocytes and monocytes, both of them, their production is increased from the bone marrow. So basically, the fourth line of defense is that the bone marrow starts producing increased amount of granulocytes and increased amount of monocytes. So this is what happens in the war between the countries. So whenever there is attack on the border, so the border forces will be activated first. Then they will get some facilitation from the forces in the nearby city. And then they will call the cantonments and they will ask for more forces. And when the war goes on for months and months and all of the forces present are involved, then in severe cases, the civilians will be hired more in the army. The new recruitment will be done. So that is the same case in here during the inflammation, the lines of defense. So first there will be macrophages, then neutrophils will come from the blood, then the monocytes will come from blood and enter into the tissues and are converted into the tissue macrophages, and then finally the bone marrow starts producing increased amount of the granulocytes and monocytes. Okay, now what are the changes which are taking place in all of them during this time? So, number 1, the tissue macrophages will be activated in the first hour because they are already present in the tissues. Whereas the neutrophils will be activated in several hours, not the first hour, in several hours. Whereas the third line of defense, the monocytes will be activated in days to weeks. So tissue macrophages in the first hour, neutrophils in several hours, and monocytes in days to weeks. whereas increased production from bone marrow will take place after months, and it will keep going on till years until the body gets rid of the infection. Okay, so what are the changes which are taking place in all of these white blood cells? So the tissue macrophages. So the tissue macrophages will increase in size. They already are macrophages, the big eating white blood cells. They will further increase their size. And secondly, the sessile macrophages will become mobile. The macrophages which are resting, which are chilling out, they will become the mobile macrophages, and they will increase their size and go for the fight. Then what will happen to the neutrophils? The neutrophils will increase in number, which is known as neutrophilia. What is neutrophilia? Increase in the number of neutrophils is neutrophilia. So the second line of defense, which is activated after a few hours, which is basically neutrophils moving from blood into the tissues, those neutrophils will increase their number, which is neutrophilia. Then we have monocytes. These monocytes are basically converted to macrophages. They increase their size and also increase the amount of lysosomes present in them. So basically, they come with a lot of guns and a lot of tanks, no? So they're converted into macrophages, they increase their size, and they increase the amount of lysosomes. Okay? So the breakdown is going to take place because of the lysosomes. Okay. Then we have the fourth line of defense, which is basically increased production, which will take place from months to years. Okay. So these are the lines of defense during inflammation, the lines of defense regarding the white blood cells. Okay. So now regarding the inflammation, we have few other points like walling off effect and pus, which we are going to discuss in this chapter. So walling off effect. What is walling off effect of inflammation? So whenever there is inflammation, there's basically vasodilation, localized vasodilation, and because of that vasodilation, there is increased permeability of the blood vessels. So when there is increased permeability of blood vessels, a lot of fibrinogen present inside the blood will move out into the interstitial spaces. So because of the increased permeability, as the WBCs are moving out into the interstitial spaces, fibrinogen will also move out into the interstitial spaces. Now what this fibrinogen is going to cause? This fibrinogen is basically going to block the tissue spaces and the lymphatics. This fibrinogen will form fibrinogen clots, and these fibrinogen clots will block all the tissue spaces and the lymphatics, and because of this, there will be walling off of the area of inflammation. And why we need walling off of the area of inflammation? Basically, we want to stop the spread of number one, the infection, and we also want to stop the spread of the inflammatory mediators to the other parts which are yet not involved in the inflammation. Okay. So there are two microorganisms. One is staphylococci and the other one is streptococci. Now, staphylococci has more toxicity as compared to streptococci. So staphylococci is more toxic as compared to streptococci, which is less toxic as compared to staphylococci. So as the staphylococci is more toxic, it has more toxicity, the body is going to respond to it with greater walling off effect. The body doesn't want any microorganism which has increased toxicity to spread to whole body. That's why the walling off effect will be greater in those microorganisms like staphylococci, which has increased toxicity. Whereas the walling off effect will be very weak, will be very decreased or very weak in the case of those organisms which have decreased toxicity, just like streptococci. So now the interesting point is, out of the staphylococci, which is more toxic, and streptococci, which is less toxic, which one has more chances to spread to the body? Obviously the one which has decreased walling off effect. The streptococci, which is said to be less toxic, will having decreased walling off effect, is easier to get spread in the body. So, which one is more dangerous, Staphylococci or Streptococci? The Staphylococci is more toxic, but the Streptococci, because of its easy spread, will become even more dangerous than Staphylococci, as it can easily spread. Okay? So this was walling off effect. Now let's discuss pus. Now what basically is pus formation? So we have discussed that there is a fight involving a lot of foreign invaders and a lot of our army in the form of different WBCs, the macrophages, neutrophils, and the monocytes. So this is a war going on. And whenever there is a war going on at any place, what happens there? There might be few dead bodies of enemy or few injured and dead bodies of the soldiers, along with the buildings being destroyed due to the war. So the combination of this whole war zone is known as pus. So the pus formation is basically the dead foreign organisms, the dead neutrophils and macrophages, and the dead necrotic tissue, along with the tissue fluids. This whole combination, which is basically post-infection, is the pus formation. Okay, so this is the pus formation. So by this, we have discussed in this part regarding the lines of defense and then walling off effect of inflammation and the pus formation post-infection. So this is it. See you in next part.